everyone. This is Dr. Kelly Clark and
Dr. Allison Van Doren.
We're over here at Patient PT on Bloomington, Indiana's North Side. And today we wanted to talk to you about a topic that is near and dear to both of our hearts as former chronic pain sufferers ourselves. And that is stabilizer muscles versus what I call dynamic movers, and Dr. Allison Van Doren likes to call
power muscles.
So how about you tell us a little bit about that, Allie?
Sure. So did you know that you have different types of muscles? Before PT school, this is something that I wasn't aware of. So stabilizer muscles are deep inside of our body. A familiar one is the rotator cuff, but less known are the stabilizer muscles around the hip. So our deep rotator muscles and gluteus medius, which is a muscle that I talk to almost all of my clients about. They're deep in the body. They stabilize our bones in relationship to each other. So alignment is a concept that people are really familiar with, but we're less familiar with the things that keep us in alignment, which is these stabilizer muscles. And they're close into the skeleton. Those hip rotators are right in here, glute med right in here. And they're different from power muscles in that they're not what we think of. They're not the muscles that are helping us lift in the sense that they're doing all this big work in power, but they are helping us lift by stabilizing our skeleton while we're moving around.
Exactly. So those power muscles, also known over in Clinic 1 as the dynamic movers, what muscles are we talking about here? We're talking about your glutes, okay? Your butt muscles. The big muscles that are kind of on the outside that we're used to training up and trying to make look pretty for our dates, those are the ones that I call dynamic movers and Dr. Van Doren likes to call the power muscles, but both are just as accurate, okay? So those little stabilizers, they're in here close to the joint, making sure that this doesn't bang around or move too much while we're swinging our leg, walking and running. And the big ones are the ones that are in charge of doing the actual swinging while we're walking and running. What happens when you don't have very much stabilization strength?
Pain.
Really?
Mm-hmm.
How about you tell us about it?
Okay. So you might think, okay, I'm really strong, or I thought I was strong, and now I'm finding out that these muscles are not holding me. I'm not stabilized. And so that can be, of course, the cause of pain because your skeleton is kind of jangling around inside of your body. So a lot of people think about stability, don't think about stability when they think about alignment. It's more like, oh, I'm thinking about my posture, so I'm sitting up straight all of a sudden. But actually, there are muscles that support us in doing this. And when they're not active and they're not on, we're in pain.
Exactly. So if you think about these joints swinging around in space a little bit too freely, some of the more sensitive tissues like muscles, tendons, even the membranes around the nerves themselves can get pinched in between things because there's just too much movement happening between these two hard places. So pain comes from a lot of different sources. We're used to talking about it in a lot of different ways. But one of the things that can get very confusing for people is the difference and the association between pain and weakness. So those stabilizers are so important because basically a weak muscle is a painful muscle. Tenderness, when it comes to muscles, tenderness to palpation, like if I poke Allison right there in her shoulder and it hurts right away, is a sign that that muscle is weak or overstretched as opposed to needing to be stretched, which is something that we think about as a remedy for pain a lot of times, but unfortunately, our stabilizer muscles are often already overstretched because we've been holding our joints in these less than ideal positions that Allie's been talking about in some recent videos.
Mm-hmm. Posture.
So what do we do about this?
Well, our bodies are incredible and they're very lazy. So our bodies will rely on the muscles that we have that are stronger. So in order to retrain our stabilizing muscles, there are a series of exercises, but not like exercise as we typically think about it. It's a lot of small, subtle engagement and basically what's known as neuromuscular ReEducation. So you're retraining your nervous system to talk to those stabilizing muscles.
Something that I talk about a lot in my clinic in relationship to neuromuscular ReEducation is posture reversal. And that's also something that Allie's been talking about in the last couple of videos. When you have shoulders that are used to staying up here close to the front of your body, those muscles that are intended to stabilize them are going to be overstretched. When you start to retrain yourself so that you're used to keeping your shoulders back and more open during your everyday activities, slowly that re-educates your brain to understand that it's better and less painful and more efficient to do those movements with your shoulder back in good alignment.
And there are specific exercises that we can do to encourage these motions.
Exactly. So everybody's a little bit different. Sometimes people do really well to start with a lot of repetitions of simple exercises. Some folks do better to start with a lot of thought and education about how to move their body best in functional movements, just like walking, sitting, standing. But whatever your style is, Allie and I are here to help you figure it out and reduce any pain that you might have related to stabilizer muscles versus those power muscles.
So come see us and feel better.